Attention, please. The show starts in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go. Bass in your face. Bass in your face.
Good evening, everybody. Welcome to another episode of Latino Diaspora. For the benefit of those of you who are not familiar with this channel or are watching this channel for the first time, what we do is we talk about issues as pertaining to Latinos, particularly Latinos residing in the United States. I want to let everybody know that I'm currently live on Facebook and YouTube. Also, subscriber mode has been enabled for the first 5 minutes, meaning if you're not a subscriber and if you wish to enter a comment in the chat, you will need to subscribe. Of course, I have my main channel, which is called Uncommon Sense with Jose Negron, where I talk about everyday issues and where we try to seek logical solutions, but not everyone uses logic. So for that reason, it is called Uncommon Sense. So if you have not done so, I'm going to want to ask you to please subscribe, like, and set the bell notification to all. So therefore, whenever I do produce content, you will have the opportunity to catch it live or catch it on the playback. Okay. So as you can see by the thumbnail, the topic for tonight, how COVID-19 has affected Latinos. Okay. I think we can all agree that COVID-19 has affected everybody in different ways. First of all, many of us have either came down with the disease or know someone that did. Some of us also loved loved ones. So we're going to have the discussion. But before we have the discussion, we're going to have another episode of In My Words. First of all, I just want to give you an update of my health. Just to recap, on June the 28th, I had revised knee replacement on my left knee. At this point, I gained almost full range of my left knee, and my knee is getting stronger. And now I'm at the point when I'm able to walk without the aid of a cane. So I really appreciate all the love and support that I've received. It seems like it seems like the Trump campaign is in another controversy regarding their visit to Arlington National Cemetery to pay their final respects to the 13 Americans who served in the military who were killed when we evacuate our forces from Afghanistan. And it is apparently that Donald Trump used the opportunity to politicize their deaths and attack Kamala Harris. And there was an employee who tried to get members of the Trump staff to respect the fact this is a cemetery. Please do not politicize it. And apparently there was some sort of physical altercation, which led to the army to pass a statement. And of course, the Trump campaign did not react well. Okay. Um, as far as what was their motive, I don't know. I don't want to speculate as far as why. According to the campaign, to pay the respects, they were invited by one of the families of one of the soldiers that were killed. So I really don't know. I don't want to speculate on that. I do know that we will have a debate September the 10th, at which both Kamala Harris and Donald Trump will make their case as far as why the vision of America is more appropriate. So it should be very interesting. Of course, we're approaching the end of summer, which for many of us, children will be going back to school. Okay. And also the days will be getting shorter. The weather will get a little cooler. And before you know it, the leaves will start to turn brown. And it'll be time for things like Harvest Moon Dancing, Halloween for those who observe, Oktoberfest, Thanksgiving, and eventually Christmas. So it's a continuation of the year. And with that being said, we're going to get into the main topic. So, COVID-19 has affected every community in different ways. Unfortunately, there have been families that have lost loved ones to the COVID-19. There are people that lost parents, siblings, children, spouses, relatives, close friends. There have been people that have lost their livelihoods as a result of COVID-19. There are people that dealt with mental issues because of the disease. So what we're going to do is we're going to examine how it's affected Latinos. Okay. Now, before I continue, let me just state the link to join the panel has been pinned. Should anyone wishes to join the panel and express a point of view regarding the subject, they can do so. As always, as I stated before, if I have never seen you before or heard from you, I will insist that you come up in the backstage. Make sure you don't flash anything inappropriate, which will cause the people of YouTube to take down their stream. So let's see, I'm going to share my screen. Just give me a moment. Okay, I'm just waiting for. Okay. So this is another website. This is the National Library of Medicine. So I'm just going to share with you, and this is the article. May of 2022. Pre-pandemic disparities place Latinos at risk for COVID-19. This report describes the associations between increased viral exposure through social content and material hardships and the uneven distribution of COVID-19 morbidity among Latinos older, using all data from the recently released supplement to the National Social Life, Health, and Aging Project, a population-based panel study of adults born between 1920 and 1965. Logistic regression revealed that material hardship and reliance on outside help were significantly correlated to the COVID-19 infection, which may partially explain the dysfunctional burden Latinos experienced during the pandemic. Pre-pandemic disparities in living and working conditions place Latinos at high risk for COVID-19. U.S. Latinos are 3 times likely to get COVID-19 and twice as likely to die of it than the general population, reducing life expectancy estimates for survival advantages of more than 3 years or less than one. However, research on factors have contributed to Latino overvote vulnerability during the pandemic has been thin. Latinos disproportionately live in dense neighborhoods in large households, which pose barriers to social distancing. They're more than twice as likely to live in multi-generational households, and 4 times as likely to live with their grandchildren, than non-Latino whites. Latinos are represented among essential workers and industries most affected by the pandemic, which increased their viral exposure. Only 16% of Latinos reported be able to work from home compared to 31.4% of non-Latino whites. This disparity is further accentuated by foreign-born Latinos and those who are residing in mixed citizenship status households, because many immigrants, even those with lawful status, may not qualify for federal pandemic relief and safety net programs. Moreover, the inclination for people to associate with others who share ethnicity, religion, education, and occupation reinforces the concentration of disadvantages for those who are already underprivileged, which means that for a population where disadvantaged coverage along racial, ethnic, and other class lines, we can expect to see disproportionate pandemic-related outcomes. Economic hardship among Latinos are well documented. Nationwide, 61% reported job or income loss in the household during COVID-19, far more than non-Latino whites. Found that 46% of Latino ages 18 to 64 reported material hardship, the inability to pay rent, mortgage, or utilities on time, or at all, ongoing food insecurity, and unmet medical needs, compared to 25% of non-whites. These vulnerabilities may motivate people to take unwanted health risks, such as increasing their involvement in an informal economy to avoid material hardship. Now, I'm not going to read all this because it's just statistical jargon, but what I will do is I will read, just give me a moment, this paragraph. Table 1 features the demographic characteristics of Latinos, non-Latino whites, and the total sample. Compared to non-Latino whites and the total sample, Latinos who are younger, 54.4% to 65%. And they have born outside of the United States, 40% completed survey in Spanish. Latinos reported lower income levels of education. More than a third have less than high school. Non-Latino whites prefer web-based. Latinos favor data collection by phone. Before the pandemic, most Latinos report having enough or more income to meet their needs. Okay, so let me just... Now, I'm just going to do is read the variables. We examine factors associated with the information of the question. How has a doctor or other healthcare provider diagnosed you, spouse, or someone else in the household, friend, or family member on the acquaintance with COVID-19? We examine the main effects to these factors: household size, live alone, 2 persons, or 3 or more, reliance on on-site help or everyday tasks, yes, no, and experience in change work due to pandemic, yes or no, not working. The behavioral test has an indicated response to the question. Okay, so this is how they did. They conducted a survey with multiple factors. And as you can see by this graph, this is the result based on acquaintances, friendship outside, household member, and self, where the gray line was Latinos, the darker gray is Latinos, the lighter gray is non-white Latino, and the total sample. So what we're going to do, we're going to park it here. So basically what they did was they conducted a survey, basically, excuse me. One of the reasons why Latinos was deeply affected is, of course, some of them are not as highly educated. Also, some of them tend to be essential workers, such as those who work in supermarkets, department stores, service employees. Of course, as I stated, one of the issues is not, of course, always is not attaining the health care that they need. Okay. Now, what I'm going to do is I'm going to share another article. Just give me a moment. Please bear with me because my computer is running a little slow. Okay. Okay. Now I'm going to share my screen. Just one moment. So the next article is from the UCLA website, the Latino Policy and Politics Institute. Okay, so this is a study which was published on May 24th of last year. And the title is The Impact of COVID-19 on Latinos, 3 years in Trends in Health Outcomes and Vaccinations in the U.S., California, and Los Angeles County. So this is the executive summary. As of May 2023, the U.S. has experienced more than 3 years of COVID-19 pandemic. Since the beginning of the pandemic, the U.S. has counted more than 104 million confirmed cases and more than 1.1 million confirmed deaths attributed to the virus. In the early months of the pandemic, a large body of research showed that COVID-19 disproportionately affected Blacks, Latinos, and Native American individuals. The vaccine rollout research showed that these efforts resulted in uneven distribution of vaccines. With the expiration of federal public emergency for COVID-19 on May 11, 2023, and the COVID-19 transitions to an endemic disease, important questions remain. These are the two questions. Have racial disparities in COVID-19 persisted since the initial peak? And to what extent have vaccination campaigns succeeded in reaching out to the most vulnerable population since the initial vaccine authorization? The answer to these questions are using available data from the Center for Disease Control and Prevention, otherwise known as CDC. We compare these rates of cumulative cases, hospitalization, and deaths raised by ethnicity of all age groups from March 2020 to February 2023 across the US, California, and Los Angeles County. We focus on our analysis on key milestones on pandemic-related vaccine availability and eligibility. We then examine the trends and shares of individuals who remain unvaccinated from December 2022 through January 2023 by race and ethnicity. This allows us to understand not only the trends of COVID-19 disparity, but also the availability and the uptake of vaccines impacting them. So these are the findings. Latinos experience a disproportionately high rate of cases, hospitalization, and deaths across the U.S., California, and Los Angeles County relative to their share of the population. As of February 2023, Latinos still represent a disproportionate share of cases of the U.S. and Los Angeles County. However, in California, Latinos share COVID-19 cases have fallen before the share of the state population. Hospitalization rates for the Black population remain disproportionately high compared to the population of, and has shown no significant improvement from the start of the pandemic in U.S., California, and Los Angeles County. COVID-19 related deaths for Latinos of all three geographic regions increased throughout the pandemic, but have remained higher than their share of the population in California and Los Angeles County. In the first 6 months of the COVID-19 vaccine became available, Latino and Black populations across the U.S., California, and Los Angeles County were the groups least likely to have completed their primary series of vaccines. Although vaccination rates among Latinos and Black populations have increased, as of 2023, California and Los Angeles County vaccination data shows higher shares of Black and Latino groups not fully vaccinated, while white and Asian populations. So I'm just going to skim through. Go ahead and with the introduction. Over the last 3 years, racial and ethnic ethnicities in the U.S. have experienced higher COVID-19 infection and mortality rates than their white counterparts. Early in the pandemic, Black, Latino, Asian, and Native American individuals faced high hospitalization and intensive care unit admissions rates due to COVID-19 than white patients. For example, Latino hospitalization rate due to COVID-19 were 4 times greater than those of their white patients. Further, as of August 2021, Latinos have experienced a mortality rate of 9.2 times that of white patients. Many of those observed COVID-19 disparities are explained by inequities in social and structural determinants of health. Black, Latino, and Asian people are more likely to live in multi-generational homes, increasing their exposure and transmission. They also are most commonly employed as frontline and public-facing workers, limiting their ability to social distance and work remotely. And simultaneously, let's get rid of this. And simultaneously often have little access to quality health care. Since 2019, Latinos have been more likely to be uninsured and more likely to experience cost-related delays in care. Black, Latino, and Asian households are more likely to report being unable to catch up with housing payments than white households between 2021 and 2022. Evidence suggests that higher eviction rates worsen than COVID-19 infection rates for these groups. These structural factors contributed to COVID-19 disparities were all more prevalent in California. In 2019, more than 2 in 5 essential California workers were Latino compared to just 1 essential worker nationally. Latinos in California were also 8 times more likely to live in crowded households with an essential worker than white people. As a result, between March and October 2020, the study shows more than 70% of COVID-19 cases in California were among Latinos, and about half of everyone who died was Latino. Death rates among Latinos and Black Californians were more than 1.5 higher than their white population. Excuse me. Now I'm just going to go on to vaccination efforts among marginalized communities. Vaccination efforts to protect against COVID-19 began at the end of 2020 and continued in 2023 with the rollout of the boosters to combat variants of the virus, despite their efforts to achieve equitable distribution of vaccinations. Disparities in vaccination rates remain prevalent by race and by ethnicity. As of July 2022, Black individuals have the lowest vaccination rate nationally. Meanwhile, in California, both Black and Latino individuals are less likely to be vaccinated than their white and Asian counterparts. Research has attributed the lower vaccination rates among marginal communities to various causes, such as exposure to misinformation about COVID-19 vaccine, mistrust in the U.S. healthcare system due to historic injustices, desires of autonomy, uncertainty, uneligibility, and discrepancy in the availability and distribution of vaccine. Although COVID-19 vaccines is free and available to all, regardless of ensuring a legal status. Some businesses administering the vaccine, major pharmacies have asked patients as proof of insurance and a social security number to receive the vaccination. Wealthier neighborhoods, which tended to be wider, also had disproportionately easier access to vaccines. And many Black and Latino communities lack the accessibility and culture and literacy of information. Slowly in Los Angeles County, early vaccine hesitancy one of the highest among Black and Latino persons and whose income was below $20,000 a year. So, just basically, just to summarize, there's been a lot of misinformation regarding the availability of the illness, also regarding the fact that the vaccines are available to those regardless of their ability to pay and regardless regarding their status. So now I'm just going to talk briefly regarding the methodology. We examined COVID-19 hospitalization and deaths in the U.S., California, and Los Angeles County using available surveillance data from the CDC, hospital, healthcare providers, and laboratories report COVID-19 cases to local public health departments as required by state. Next, health departments voluntarily send the identified patient level data about COVID-19 cases to the CDC. Using the CDC data, we analyzed COVID-19 trends for Latino, Black, white, and Asian population of all age groups and compared them to their shares of the overall population in each respective geography. Data for Latinos are any race, and data for all other races and ethnicity are non-Hispanic population estimates white non-Hispanic, black non-Hispanic, and Asian non-Hispanic. So basically, they're different groups. So now we're going to discuss the foundings. In the first year of the pandemic, Latinos were disproportionately affected across all three geographies examined. Although Latinos represented 18% of the U.S. population in 2019, they accounted for 32% of the cases from March 2020 throughout December 2020. In recent months, the share of causes among Latinos also started to approach or finally fall before their share of the population. Good evening, Irby. Thank you very much for stopping by. Irrespective of geography, throughout the pandemic, cases and rates among Black and Asian population were closer to the population share of the U.S. and California, but not in Los Angeles County. Meanwhile, Black population in Los Angeles have experienced a greater share of COVID-19 cases than their share of population. So just as a follow-up, just to let everybody know, we're talking about how COVID-19 has affected Latinos. Okay, but of course, COVID-19 has affected other ethnic groups as well. And you can see by this bar graph going from December of 2020 to February of 2023. So here are the cases as far as COVID-19. So this is the group is for Latinos, white, Black, and Asian. Also some more statistical data as well. So let's see, the first graph has to do with the United States. The second group has to do with statistical data in California. And the third is in Los Angeles County. Right here, these are the hospitalizations in the United States from December of 2020 to February of 2023. So these are the percentages of hospitalization for Latinos infected with COVID-19. These are this is the percentage hospitalization for Caucasians, Blacks, and Asians. And here, this is the statistical data regarding Los Angeles, California. And as you can see here, the large number of those hospitalizations are from Latino and white. And the same thing applies as far as for Los Angeles County. Now, what I'm going to show you here, these are the COVID-19 deaths. The first set of statistical data is in total of the U.S. So here it shows the over 50% of the deaths through COVID-19 are white, while a significant portion of the deaths from COVID-19 occur with Latinos and similar to Blacks. Now, when it comes to COVID-19 deaths in the state of California, for the same period, as you can see, More than one third of the COVID-19 deaths were afflicted by Latinos, and more one third were whites. And a similar situation applies for Los Angeles County. Okay. I would suggest that there have been various campaigns. Some of them through perhaps the CDC, hospitals, clinics, various organizations that have tried to educate Latinos in regards to COVID-19 and also regarding what are the causes and information regarding vaccines. Now here it shows the share of the population that's not fully vaccinated in the U.S. Okay, so as of May of 2021, almost two-thirds of the Latino population have not been fully vaccinated. Almost the same applied to the white population, and almost three-fourths of the Black population have not been fully vaccinated. So, and then 6 months later, it was reduced to less than half of the Latinos not fully vaccinated, and it's roughly the same for whites. In the Black population, more became vaccinated, but it's still roughly almost two-thirds. As you can see, as each cycle, it appears more and more of the population are getting vaccinated. And here is the share of those who have not been fully vaccinated in the state of California, which is similar. And the same situation, more or less the same situation in Los Angeles County. So this is, this bar graph shows that as of January of 2023, 55% of the Black population has not been fully vaccinated. 48% of the white population have been fully vaccinated. 40% of the Latino population have been fully vaccinated. And 33% of the Asian population has not been fully vaccinated. I think part of it has to do with mistrust of the government, also mistrust regarding certain information when it comes to the vaccines. Also, there's been some considerable misinformation spread. And this is for the statistical data for California. And this is the statistical data for Los Angeles County. So now I'm just going to read to you the conclusion. 1. Have racial disparities in COVID-19 outcomes persisted since the initial peaks, or have outcomes confirmed? And 2. To what extent vaccination campaigns succeeded in reaching out the most vulnerable populations since the initial vaccine authorization? So I'm just going to go to the next paragraph. Even after vaccines became available, Latinos and Black individuals continue to experience a greater burden of COVID-19 cases, hospitalization, and deaths throughout the remainder of the pandemic. The persistent burden experienced by Latino and Black population is a reflection of the structural disadvantage of these communities as faced with the pandemic, such as greater likelihood of living in multi-generational homes and working the frontline public-facing workers. As we move forward into the endemic phase, the plan for the future outbreaks for COVID-19 variants or the new diseases altogether, strategies to reduce transmission and reduce the disproportionate burden on our most vulnerable communities, most subject to social inequities, the population and ethnic disparities. So these are the policy recommendations. Okay. Improve the public health data infrastructure. Our analysis of COVID-19 outcomes and vaccination was limited by the availability of basic ethnic information. So basically, system limitations, because a large portion of this population has Medicaid. And then the next part recommends to continue to support equitable access to resources necessary to alleviate the burden of COVID-19 among the minority population. To alleviate the health disparities among the population, lawmakers need to community policies rooted in the equitable distribution of resources. The third recommendation, ensure free subsidized access to COVID-19 vaccines and boosters for the uninsured. Okay. And reauthorize and bolster the Pandemic and All Healthcare Preparation Act. In 2006, Congress passed the Pandemic and Anti-Hazards Preparation Act in order to improve the nation's public health and medical preparedness and responsive capabilities in emergencies. And I'm going to park it here. So as we can see here, without going into the diet, the statistical data, communities of color in general have faced many obstacles in regards to the pandemic. First of all, because many of these communities are working the front lines. Many of them, they live with multi-generational homes, okay, which makes social distancing very difficult. Also, there's been misinformation. Now, some of it, unfortunately, is due to the politicians. And one thing that made it more of a challenge is that you have different policies depending in which state that you reside in. In states where it was Republican states, there was not an emphasis of making sure people get vaccinated, making sure people wear masks. Here in New York, particularly on the onset of the COVID-19 pandemic, we were on lockdown. Okay, we had curfew. We had to be in our homes by a certain time. Okay, we couldn't gather in large groups in an attempt to try to reduce the spread. We also had to adapt certain practices. First of all, we had to wear masks, okay, which we did. And we have to practice social distancing, meaning keep yourself 6 feet apart. Also, wash your hands thoroughly for 20 seconds. And of course, there was a lot of misinformation has to do with masks. First of all, we was told that the masks are only for the medical staff and what have you. Then we were told that the mask should be made available to all, which was. Also, we were told that we had to have a cloth mask and a disposable mask. Then we were told that once if we were vaccinated, that we didn't need to wear a mask. Then we were told, well, even though you were vaccinated, you still need to wear a mask again. So there was a great deal of changing information. Okay. And of course, we all know that the the pandemic did start under the Trump administration, and of course, there was controversies because again misinformation and speculation regarding the effects and when it was over, with things of that nature. So here we are. We're getting close to the end of the fourth year of the pandemic. Okay. I mean, the good news is not as many people have been dying um, as a result of COVID-19. Also, there are vaccines that are available. Now, of course, people tend to be hesitant. One thing that I've continued to state since the beginning of the pandemic was the following. Instead of me telling you what to do, what you do is I encourage people to be proactive. So what I encourage people to do, speak with their primary care physician. Ask them questions regarding the COVID-19. Encourage them to seek, to inquire regarding the symptoms, and then based on the information that they receive by their doctors, that they should act accordingly. Okay. One of the consequences regarding COVID-19 that there was vaccinated mandates. Okay. In many cities, um, employees were terminated for refusing to get the job. Okay. Some of them state religious objections. Others state certain concerns and misgivings regarding the effectiveness of the vaccines. Also, to be perfectly fair, there was information that we didn't know. We were not fully aware in regards to the side effects uh, of of the diseases. So I know here in New York, hundreds of municipal employees were terminated for their refusal to get the job. Now, in my case, I did get the job, okay? But then again, my motivation was the following, okay? First of all, I wanted to make sure that I do everything possible to protect my health. Also, I have other outlying conditions which should I should I do come down with COVID-19 can have adverse effects, um, not just me but for other people as well. So I made a decision um, to get vaccinated, and I know many people who did come down with COVID-19. Okay, and unfortunately, when you have a disease where there's not a lot of information, ignorance spreads. And unfortunately, the people that were victims of this misinformation were Orientals, particularly those who are Chinese. And it doesn't help when you have a president that refers to COVID-19 as a Chinese disease and things of that nature. And I'll say this much: among the other effects when it comes to COVID-19 is that the elderly, that particularly the elderly that resided in nursing homes. Okay, so what happened was many of them were isolated because in order, they couldn't have visitors to come see them. So basically, what they had to rely upon was Zoom meetings and virtual, virtual get-togethers. Okay, and one thing we have to bear in mind when it comes to the elderly is not all of them are tech savvy. I know I'm not always that tech savvy. Okay, and unfortunately, what happened was as a result of COVID-19. Um, Many elderly patients died alone. Okay. I know when my mother was hospitalized during COVID-19, um, unfortunately, I was not able to escort my mom to the ER, which meant that my mother was all alone in the emergency room. Well, anyone there to comfort them. The only ones that would be, the available were the medical staff with masks and gowns and face shields and all that sort of thing. And of course, when my mother passed away, we couldn't invite our friends to the funeral to pay their final respects. So it was just family. Also, another result of COVID-19 is that visitation was very restricted. So what me and my siblings did was we arranged a schedule, okay, because in the hospital that my mother was being treated, um, they were only allowing 2 visitors per day. So that means me and my siblings, what we had to do, we had to take turns as far as which ones are going to come visit and make sure no one makes any surprise visits because that means that person who was scheduled to visit my mom would not be able. And then, unfortunately, my mother um, suffered a massive stroke, which left her in a vegetative state, of which she was not able to speak. She's not able to do anything for herself, and this resulted that my mother was placed in hospice care. And of course, all of us took turns looking after our mom. We did have home attendant service 24/7, okay, until the time where my mother passed away. So, and I had been talking for almost an hour. So, if anyone wishes to hit the link and express their opinion regarding the topic, they can do so. If anyone wishes to express any comments, they're more than welcome to do so. If no one does either, then I'll start to wrap this up. Okay. But one thing, no, we'll never go back fully to life what it was before COVID-19. The best we can do is to educate ourselves regarding all the symptoms of the disease and all the different variants, what have you. Make sure that we do everything possible to limit our exposure to COVID-19. And also, if you're not feeling well, do not go to work. Stay home. Okay. Of course, as another effect has to do with COVID-19 was virtual appointments. Well, basically, in the form of a Zoom meeting, you would have a doctor basically ask you questions, and you'll get the symptoms and things of that nature. I know that December 2020, Christmas time was a very sad time because, first of all, it was the first holiday without my oldest sister and my mom. Also, we couldn't gather in large groups. So, as a result, I spent part of the evening on Christmas Eve alone. The same thing as far as New Year's Eve. There was a Zoom link, but that was not the same thing. Okay. And unfortunately, you did have cases where more people suffer from mental health issues. There have been also more cases of domestic violence and also increased cases of self-deletions. So being that no one is going to comment any further, no one is hitting the link. So what I'm going to do is I'm going to start to wrap this up. Okay, so in short, COVID-19 had devastating effects, particularly communities of color. Okay. How to combat it? Well, we have to do better educating people regarding COVID-19, educate people that the vaccines are available and they're free, regardless of your ability to pay and regardless of your immigration status. Okay. And of course, we're going to continue to get these variants, and then there's going to be more booster shots. When will this end? At the risk of sounding preachy, only God knows. The key is to keep yourself informed and disregard the misinformation. Now, I will be live tomorrow night on my main channel, which is Uncommon Sense with Jose Negron. And the topic is, can women live happy lives? So what I'm going to do is I came across a video clip from Dee, who is a very successful African-American YouTube creator who has a YouTube channel, very successful. She talks about how there are certain women that try to keep women unhappy. So what I'm going to do tomorrow is I'm going to give a reaction to a video that she created. Okay. And then we're just going to have our discussion about it. Of course, I'm going to state the disclaimer: not all women are out there trying to keep women unhappy. Okay, unfortunately, you do see that on social media. So I'm going to give you my impression. So a huge shout out to everyone who's going to see this, seen it in the clouds, and we'll see it in the playback. And of course, all of you can enter your comments after the stream is over. Just make sure that the comments are respectable. If it's not, they'll be deleted. So with that being said, I'll see you all next time. So take care, have a good night, and peace.
Be strong.